And if there's anyone in this room who has a patient who is undergoing treatment for cancer and you're a caregivers, I think I give you a heads up for that. It is a big journey. Families work with this patient from day one. They're the ones who are dependent on in terms of the treatment, sometimes cost, the imaging, the blood test, nutrition, and even these other special treatment. It is the family that do that. So is nothing much I can ask or for, because I think majority of the things that we intend or we ask families already are doing. Most of the time, this journey is usually very long, and without a stable social support, you or the patient might not make it. So families are very important, and social support is very important, and I really thank for the ones that have been stood up well with in terms of the social support. For most of the time, patients have really done well because they have somewhere they can rely when it comes to medication costs, when they come to tests costs, and even the nutrition services and other services that are needed. Families have always stood with them, and it's really a very vital point, and they play a very vital role when it comes to treatment of cancer patients.
Thank you so much. So you're saying that families are integral when it comes to supporting cancer patients?
Yes, very integral. Okay.
Thank you so much. Back to you, Dr. Mutuma. You've highlighted about the essence of screening. Yeah? Maybe you can... Yes. So you've highlighted on the importance of screening. Maybe you can elaborate further in terms of why is it essential? Or rather, why does early and accurate diagnosis improve the treatment outcomes?
Right, thank you very much for that. I think I would like to go a bit back when it comes to screening. And I want to talk about prevention and control of cancer, which is very, very important. And normally, when cancer starts, you can't stop it. It is progressive, and it progresses throughout. And that's why when you are diagnosed with cancer, time is very important, because cancer does not wait. Cancer is not a disease where you say, let us wait and see. Cancer is not a disease where you say, let us wait to look for money. Cancer is not a disease where you say, next week I will go and sell a cow. I think Daktari has seen so much of that. Patient, they have got cancer, and then they are waiting to sell a land, to sell a cow. By the time you sell that cow and that land to come for treatment, the treatment has no value. You have already sold your land, but at that time, the doctor cannot do anything. And that's why what we need to focus on, and that's what I focus on, and I think, let me be clear that this one, I've got a diploma on cancer control and prevention. So when I'm talking about screening, I don't normally talk about the screening per se. I like to go back, talk about those who don't have cancer, what you can do. Now, what is screening? Let me start from there first. Screening is going to see the doctor or to be checked when we have no disease. There's a difference between screening and diagnosis. Diagnosis is when you go see the doctor because you have a problem. You are vomiting and you go to see the doctor. That's not screening. Or you have lost weight and you want to see the doctor. Or you are a man and you cannot pass urine, and now you want to see a doctor because you have issue passing urine because of cancer of the prostate, or you have passed urine and it has got blood, and you go to see a doctor. That's not screening. That is diagnosis. Diagnosis is when you see a doctor with the signs and symptoms of cancer. That's diagnosis. Screening. Screening is for all of us who are here and we are not sick. You are not feeling anything. You are enjoying your life, but you want to be checked. And normally what we are saying is that check cancer before it checks you. when it has checked you and you have got the signs, you are already late. And that's why we have said, and we know very well, that over 90% of our patients today, they come at stage 4 because they are normally checked by the cancer before they check the cancer. So screening is checking the cancer when you have no signs and symptoms at all. The more screening we do, the more lives we save. The more screening we do, the more lives we save. The more we know about cancer, the more lives we save. Diagnosis is very important and is very complicated, and diagnosis is always delayed because of many factors. But the more we know about cancer, as an individual, as a society, and as a country, the more we save lives. The more we know cancer, and more we do the screening. Now, there are cancers which are not screenable, and the screening is actually doing a test when somebody is not sick. That one I have to emphasize, because people think that when you tell people go for screening, like now they're screening there. There are hospitals have come here, and I want to thank them. They want to screen for cancers and other non-communicable diseases, because that's we need to emphasize that all the time, is that when you're going for screening for the cancer, you have no signs and symptoms but to be checked. And that's why we normally recommend all the time people to be screened for cancer. And screening for cancer has no limitation of age. I know most people don't know that, or rather people, they assume cancer is for the aged. Of course, cancer is common in the aged, but screening can be done at all ages from day one. Because children have got cancer, Dr. Ada mentioned that. Children have got cancers. It's good for children to be screened for cancers. It's good for adults to be screened for cancers. I want to go to a bit of details about cancers which are screenable and cancers which are not screenable. There are cancers which cannot be screened. The most important factor of a screening test, it must be simple and cheap. Screening test of cancers, it should be simple test and very cheap. Which cancers are screenable and they are cheap, and everybody should be screened. And I hope we have got that plan today. I'll start with women first. Cancer of the breast, it is easiest to be screened. That's the easiest to be screened. In fact, cancer of the breast for screening, you don't need anybody for the ladies. Cancer of the breast, you don't need anybody, just do yourself breast examination. That's what we recommend as doctors. Because 90% of the patients who have got cancer of the breast, they're the ones who know they've got cancer of the breast, because they touch their breast and find that my breast is large, or there's something moving in my breast. That's the self-breast examination. It's very important for all ladies. And nowadays, I say from age of 9 years. I mean 9 years. All ladies from the age of 9 years. As older as you grow, it's always very important to be able to examine your breast all the time. And of course, after that 5 years, of course, we recommend mammogram and other tests. But what's very important for screening cancer of the breast is mainly self-breast examination. Very important. Second, cancer of the cervix. Cancer of the breast is the commonest cancer in women in the world. And also the commonest cancer in Kenya. In women, cancer of the breast. That's why it's very important for every lady and of course every man to understand a bit of cancer of the breast. And everybody sitting here, I know you have seen somebody cancer of the breast, and you know the outcome and how difficult it is during the treatment. Now, cancer of the cervix. Almost 100% of the patients who have got cancer of the cervix, they come stage 4. Cancer of the cervix is the cancer which can be screened and can be detected early and can be actually eliminated from any society. It is difficult to find a patient with cancer of the cervix in Britain or in Europe or in Western world. Why? Because they do pap smear every 2 years or 5 or 4 years, depending on the age. And they have already given some vaccination. And that's why cancer of the cervix, which is the cancer killer number 1 in women in Kenya today, it can be eliminated completely by just doing pap smear. And I hope today we can be able to do pap smear. And normally I recommend to do pap smear all ladies from the age of 18. At least you do 2 years by the time you have 55 years. After 55 years, do every 4 years. And also after 75 years, no need of screening. Pap smear is very important screening test, which was one of the tests which eliminated cancer in the world, most of the developed countries. The rest of the cancers now, cancer of the pancreas, cancer of the liver, cancer of the colon, cancer of the gallbladder, cancer of the prostate now in men, you can do by doing blood test. Very simple blood test, very cheap. Like cancer of the prostate, if you're a man and you're over 40 years. Of course, if you're a man and below 40 years, don't bother. Life has not started. It is only when you are 40 years, we normally recommend men to do pap smear. It's very easy. It takes 2 minutes. I hope he's here. It takes very easy. So screening for cancers is very important. Cancer of the breast, cancer of the cervix, cancer of the stomach, cancer of the ovary for ladies, and cancer of the liver, cancer of the pancreas, by very simple tests. Now, there are cancers which are not screenable. Like cancer of the brain. You can't screen for it. There is no simple test. You can screen it, but the screening is so expensive, so that's not a screening test. So the screening test must be cheap, easily accessible, and you do it when you have no signs and symptoms. That's cancer of the breast, cancer of the brain, not easily screened because you do MRI, CT scan, that's not a screening test. Cancer of the stomach, by doing, or cancer of the colon, by doing colonoscopy or endoscopy, yes, it's a screening test, but it's not cheap. And most of the people, very few people can go to be screened cancer of the stomach and also colon, endoscopy, colonoscopy without symptoms. And that's why we don't refer that as a screening test. And of course, the other test you can be screened, you can use to screen cancer of the colon, CEA. It's very important for cancer of the colon. But remember, what's very important is that screening, there are cancers which are screenable, other cancers are not screenable at all. And that's why, for those cancers that are screenable, the common cancers, is very important to try to be screened as frequently as possible. It depends the frequency of screening, it depends which cancer it is, and also depends on age. Thank you.
Wow, thank you. A round of applause. Wow. Daktari, maybe you could elaborate for us how effective is the HPV, human papillomavirus vaccine, in preventing cervical cancer? And what misconceptions should we address as a community?
Yeah, that's a very important question. And I think that is something that we need to highlight very clearly. When you talk of HPV, we are saying that majority of cancer of the cervix is caused by the HPV virus. Yeah, and having said that, there are very many strains of HPV virus. And if we talk about cancer of the cervix, actually, we say that it is sexually transmitted, in that it is a HPV, majority are caused by HPV. And if you deal with the HPV, then it means you'll prevent this number of cervical cancers. And that is what Dr. Mutuma said, that in some Western world, they rarely hear of cervical cancer because they have introduced the HPV vaccine, they have improved their screening programs, such that even those who get the cancer, they are caught very early. In terms of the strains of HPV, there are those which are specifically associated with the cancer of the cervix, and those are the strains that are the basis of the vaccine that you hear about. They are numbered. They are number 16, 18. Those are the two very common ones. And you'll find the first vaccine that we used to use, the Civarex, it is based on that. But the others, the Gardasil, which could be having against 9 or against 6 of the strains. And what we are saying is that when you give these children, and we say children from the age of even 9, but in our country there are the age limit that is given, because remember, every country has to see how to prioritize their resources. because they have many programs. So they give a definition of the period where they will capture the children. We also talk about giving the boys the same vaccine. I know some people might not have heard that the boys can also be given the vaccine. It's only that it is not introduced in our government program to give the boys a vaccine. What you're saying, the vaccine is very effective. And that is why we want to give on to those small girls before they get infected by the HPV. And that's why we want to catch them before they start engaging in sexual intercourse, such that they are not exposed to the HPV. So, and the vaccine can be given to any age of a person. Even those who have been exposed to sexual activity, it will still have some protective value. Maybe not as much as those who have not been exposed before, but it is a very effective vaccine. And I would encourage all the mothers who are here and the fathers, if you have those who are eligible, please take them for the vaccine. It is a safe vaccine. It is very safe. There are many myths about it. People will associate it with fertility. People will associate it with, anything brought by government, people always have suspicion. But from a clinical point of view, from being a person who deals with these advanced cases of cervical cancer, I would tell you it is a safe vaccine. All the myths that are there, sometimes you may find religious groups who are opposed to these vaccines. And I think the church is one of the places where we should bring it to, so that you understand what the HPV vaccine is. You even see, if you engage Dr. Muntuma or you engage me, we can even show you the studies done on all these vaccines, so that you can be the advocates for this vaccine. If you can have that step from the church, it will penetrate the whole community. And the programs are free with the government. So it is encouraged that we go for those vaccines. They are effective and they are safe for our girls.
Wow, a round of applause. And lastly, to you, Dr. Obonyo. So why is symptom management and quality of life an essential part of cancer care?
Yes, thank you so much. Is it over now?
Yeah, it is.
Okay, so thank you so much. Maybe just come back again with the question.
So why is symptom management and quality of life an essential part of cancer care?
Well, that is very important. Symptomatic management is usually, some of these patients, most of them, when they come for treatment, especially for advanced cases of cancer, they come when already they're symptomatic. Either they come with either dizziness, meaning maybe their blood levels are low. Some come when they are already vomiting, some are not feeding, they are wasted. And it is important first to address the symptoms that bring them, because it is important when you are going to treat them, then they are very stable. Remember, for your body to address or accept this treatment, you must be very stable for this treatment to be effective. For example, someone who is very sick, maybe in cancer we use some ECOG state to just assess the stability of the patient. Someone who is at maybe the advanced stage with an advanced ECOG status of 4, for example, might not benefit from treatment, aggressive treatment. So it is important first to stabilize this patient, manage the symptoms that brought them. Nutritionally, they have to be okay. HBs are well, they are feeding okay, they are walking, they are stable generally, so that their bodies are ready to accept the treatment moving forward. Remember, these treatments are sometimes quite aggressive. They take a toll on the patient. They can altogether make the patient either become more weaker or they can make the patient become better. But again, depends on how the patient is stable. So it is important we first address the symptoms before we start the aggressive treatment.
Wow, a round of applause to him. And I would want to open up the floor to anyone who has a question, and I will request us kindly address it to the specific panelists that you would want to respond to that particular question. So anyone who has a question, you can just shoot your hand up, and we will ensure the mic comes right to you. Anyone who has a question? Oh, there's a question right here in front. Okay.
Good afternoon, everyone, and thank you for the insightful session we had. My name is Steven. I like Dr. Mutuvi, if I'm correct. Just to get your opinion on the thing that is now currently trending, you'll see people saying they are fasting to kill cancer or preventing cancer, more like fasting. So what is your take in that? And would you encourage such practices to the masses? Because I know everyone is scared of cancer and will do anything just to prevent cancer from occurring. So what will be your input on that?
Okay, maybe we can take 2 more questions and then we can have the entire panel discuss. Anybody else? All right.
Good afternoon. My question, or rather my suggestion, goes to Dr. Mutuma. Now that we find screening is the most important part in handling this cancer, can there be a way where people can be educated about screening? Because now, like now as today, we have known that, but there are a lot of people who doesn't have that knowledge of going to be screened. So is there a way maybe which can be done so that people can be educated and understand that the screening is very important? Thank you.
Good afternoon. I think mine is connected with the first one. Good afternoon. I'm Esther, and I think my question is connected with the first person's question. And our doctor had started, he mentioned, but he didn't elaborate. Like you had said, you explained about screening, and then you said for those who don't have, like what to do when you don't have. So preventive measures.
All right, and final question.
Good afternoon. My name is Zipporah from Dr. Mutuma. I think this is your question. You said more for the ladies, they need to do breast examinations. Can you kindly give us a format on what the ladies should do? Because most of them are just watching and they don't know where to start and where to end about breast examination.
All right, thank you very much. So that's a series of 4 questions. Can you take one more? And then I think that will wrap up the session. Okay, one final question. And then just give the specific doctor that you want them to answer.
Okay, hello everyone, my name is Eric. I would like to ask Dr. Mutuma a question concerning if we say that cancer is a growing cell, and then we know we have immune system. Why does immune system importantly know that problem and just destroy it completely?
All right, thank you. That's a series of 5 questions. So I give it up to the moderator to. Yeah.
Thank you very much. So I can see so many questions have been addressed to Dr. Mutuma. So perhaps you could respond.
Right, I think there are so many, I've forgotten all of them. Now, I don't know which one to start with. Was somebody writing them down? The first one, it is the fasting as a way of treatment of cancer, and the fasting as a way of prevention of cancer, or mainly diet. Diet is my subject. That's what I like most. And because of my training on cancer prevention and control, the most important thing is the diet, is the food you eat. Normally, cancer cells grow very fast, and they require food all the time. Now, which food is very good for cancer cells to grow? And normally, I'm very sensitive when I'm talking about this, and I'll give you at least 4 or 5 foods which makes cancer to grow. So that's the first thing. Of course, me, I don't treat cancer, I just diagnose. When I diagnose, namalizia hapo nasiendelei. Now, 1, the worst food for cancer to grow, or the best food for cancer control, is sugar. Sugar is cancer feeder number 1. Second is milk. The milk we take, the cholesterol and the fat. The cancer likes sugar and fat because it makes the cells grow quite well. And of course, sugar and fat is connected to what we love most. That's chapatis and bread. That's carbohydrates. Carbohydrates also sugar. Now, you find that when you talk like that, everybody has taken that food today. And that's the first and the most important thing which we normally advise patients. If you want to, when you've got cancer and you don't want it to grow fast, you reduce. I don't use stop. You reduce those foods because they like cancer to grow. And I know there's a whole topic of the food which does not contain carbohydrates or sugar, or foods which can be converted to sugar very fast. It's called ketogenic diet, which is mainly you eat proteins and you reduce carbohydrates, anything which can be converted to sugar, which normally very important. So fasting, the first thing is that when you've got cancer, you cannot fast because it's already growing, taking all the food you have, and the food which you taken, the cancer takes it. That's why you reduce weight. So when you've got cancer, you just have to change your diet from carbohydrates and sugars into more proteins, and more so into salads and cooked food, because that's best food which will give you energy and do not make the cancer to grow. And that's why you cannot talk about fasting when you've got cancer. We talk about fasting when you don't have cancer. And that's why we say one of the risk factors, apart from diet, the other risk factor which is connected to that diet is obesity. For cancer prevention, and that's why cancer is becoming very common nowadays, because we've got obesity because of eating more of carbohydrates, increasing our weight. And that's why one of the ways to reduce the chance or to delay the cancer, I don't like saying to prevent cancer from coming, is to reduce the chance of cancer, or to delay the cancer from coming to you is to manage your weight and manage your sugars and carbohydrates. I think the other question, I think if you remember very well, was on the immunity, which is very important, and cancer. Cancer is common in developed countries, and one of the developed countries in Kenya nowadays. That's why cancer is very common in Kenya, because we are a bit rich. We have got express way, we have got thicker super highway, and we are rich. We are one of the richest countries. Of course, we are going to Singapore, that's okay. But what is very important is that immunity, cancer is for rich people. Cancer is not for poor people. When I was in school, when I was in school, we didn't have a topic in cancer because cancer was not a problem in Kenya. Because we used to call it Western type of diseases. Because cancer was very rare in Kenya and it was not a topic. In fact, I came to know about cancer when I was doing pathology. And even when I was doing pathology, cancer was not there because we were not that rich. Nowadays, we have got so much cancer because of the diet we eat. The diet we eat is the diet of the rich people. And that's why I found that in Kenya, anybody taking a breakfast in Kenya, there's no difference with somebody in London taking breakfast. It is the same. And I know there are so many questions, and I don't want to talk too much. I think for the rest of the panelists, if there's something I've left or want to add, please add, and then I can answer the rest of the questions. Any of the panelists, if you want to add anything, what I've said, or answer the questions they have asked, no problem. You can always answer, and then I'll be able to add that later. Thank you.
Dr. Ndiritu, round of applause.
I think what I want to add is still on the issue of diet, because people starve cancer patients in the name of controlling diet. And remember, we are giving them all these treatments which we are said they are toxic. The cancer itself is not allowing them to eat adequately. We want them to eat a balanced diet. When we talk about restricting the diets, even for the healthy person who has no cancer, what Dr. Mutuma has talked about is that it's not that you don't take those things, you have to moderate them. Reduce the sugar intake, reduce the refined sugar intake. So that is what you're cutting down on. And the association with cancer is not a direct association of the sugar. When you take those sugars in excess, you get other conditions that predispose you to cancer, like obesity. That is why you need to moderate the amount of sugars you take. Don't live a sedentary life, have some bit of exercise so that you maintain a healthy body weight. So in terms of how you, there is a whole topic about diet and cancer patients, which we need to be very careful, because I get patients and they tell me that, there are many doctors out there, not just in the hospitals. And you find a patient has nothing that they can take. They have been told to take boiled food, don't add salt, don't take sugar, don't take milk. The patient is left with nothing to take. That is not a diet for a cancer patient. All those things are required by the patient. They need the nutrients to be able to, for the tissues to recover, the repair. We are giving radiotherapy. We are killing some cancer cells and some normal cells. This patient needs to recover from that. They need the energy. So they need to take a balanced diet which is having all these components, the carbohydrates and all that. There is what you regulate, there is the moderation we are talking about. So don't get confused about diet and starve my patients before they get their treatment. I think that is what I would want to talk about, the diet. There is one question probably I'll help Dr. Mutuma answer about. It was somebody who asked about immune system. Dr. Mutuma will deal with that. I want to talk about the screening and the breast self-breast examination. Somebody asked about, we have talked about screening and how important it is, and he was wondering, those who are not here, how will they know that the screening happens and where does it happen? You find in most hospitals, you have screening being done. You find if you look at the calendar from January to December, every month is given a certain cancer that is highlighted. And you find hospitals with target screening for those cancers. But screening for all the cancers happens throughout. If you go to any health facility, all the government facilities, they have that. Private facilities, they have that. In terms of education, this is one of the forums where we do that. We try to give these talks in churches, we go to institutions, we go to workplaces, and we talk to people about screening. When you have this information, it should not end here. Your representatives of the community should be able to take this information there. Get to the organizers or the church leadership. Ask them, these people who came to talk to us, where have they come from? I would want to get more information about them. They'll give you the contacts, you'll be able to come and have yourself screened. You'll also be able to be advised. It's not only prostate cancer that you can get screened on. You'll be given more information and we'll screen, not just about cancer. And remember we said screening is for healthy people. It's not for the sick person. The sick person is coming for diagnosis and treatment. A healthy person like you and me are the ones who are being screened. In terms of breast examination, also that is done in the facility. If you come to our facility, we will be able to, we'll have people who will be able to show you how to do yourself breast examination. And that is a very easy process. And usually we even have literature showing you and videos showing you how to do it by yourself at home. So if you get in touch with us, we'll be able to give you that information, if you, maybe through your church leadership, and you'll be able to get that. But if you enter any government facility or any of these major hospitals that have comprehensive services, you'll be able to be navigated, and you'll be able to be shown how to do your self-breast examination. You'll be told when you need now to come for the clinical breast examination, and the process and also the intervals at which you do that. I think there's somebody who wanted you to deal with the immunity issue.
Yeah, let me add something.
Yeah.
Now, let me add something on fasting, and they have been all well addressed by Dr. Mutuma and Dr. Nderitu. Most of the time, when we manage cancer patients, we do what we call a multidisciplinary. And the way Dr. Nderitu put it, there are many doctors out there. TikTok is full with a lot of information. Some are correct, some are misleading, some are myth, and there's a lot of research that are going on. So we usually involve the nutritionist for the purposes of anything that involves nutrition. And please, out there are many nutritionists in quote. So please let us get the correct information when it comes to food and nutrition from our specialists that we really regard and we really uphold. And number two, just to come in, the other question about what do we do that now someone who does not have a cancer that has already gone for screening in terms of prevention. Majority of cancers are associated with the risk factors. And we know the risk factors have been highlighted by Dr. Mutuma. He talked about, the quitting of, the environmental exposure, diet, and it's about lifestyle. So and other than doing screening, then in terms of prevention, quit smoking, quit alcohol. There are environmental exposures, the pollution, chemicals, pesticides. There are also viruses like the HPV, hepatitis B viruses and all that. We can screen them. But the most important is, after going for screening and you realize that you are not having these strains, the next thing is now avoid other risk factors by doing the preventive measures. Then the last question, just before Dr. Mutuma comes in, for the immune system. It was asked from one person here. In our body, when God created all of us, God put all of us, he put what we call an immune system. See, that's true. So this immune system, its main work is to defend us from infection, from diseases, viruses, bacteria, and all that. And the special cells that do this are called T cells. Now, cancer cells are abnormal. And their main work is kwanza to hide from these T cells. Just for example, let me give a hypothetical example. If someone wants to come and attack us in this church, the first thing he will do is to hide from us. See, that's true. So that we don't recognize him. And then what happens thereafter? It does its own things, attacks us when we are not ready. So that's how cancer cells behave. They attack you, they first hide, and then they attack you. And I think you heard what Dr. Nderitu talked about in terms of treatment. There's what we call immunotherapy. And immunotherapies, there are others called examples. We have immune checkpoint inhibitors, and even the CAR T cells that are coming in. All these drugs are coming in just to, like the immune checkpoint inhibitors, they are to break these hiding areas so that these T cells can recognize. They are not chemotherapy per se, but you see, they are created in a way that they are going to sensitize your immune system to recognize cancer cells, right? But otherwise, the cancer cells, the main thing they do is to hide from the T cells so that they are not recognized, so that they can now affect you and even kill you. Thank you so much.
Thank you. And maybe before we go to a round of applause, As we wrap up the session, maybe before we go to Dr. Mutuma, you can give us what are your closing remarks? What's that one thing that you would want to tell the audience?
I always say it every time that I go for these sessions. Number one thing is let us go for early screening. Let us ensure preventive measures and get information from the correct people. Let us not be misled. And let's also share the information out there that screening, prevention, and early diagnosis saves life. Thank you.
Thank you. A round of applause. Dr. Ndiritu?
I think for me, my closing remark is to encourage people that cancer is treatable, to encourage them that these treatments are available in Kenya, and also be afraid of your healthcare worker. Get screened when you need to. If you have anything that you're not sure of, let it be checked. Let the doctor tell you that this is normal. Don't assume anything, but bottom line is get yourself checked regularly.
Thank you. A round of applause. And lastly, Dr. Mutumu.
Okay, I think first I would like to talk about immunity, which had been asked several times. There's nothing I can say about immunity because we get it through the diet. And I've talked about the best food where you can be able to take so that your immunity is better and your body does not encourage the cancer cells to grow. And I know that talk is very cheap. I believe in action. I normally promote immune boosters. And I think most of people have heard about this. There are food supplements which are very important to prevention of cancer. When you've got cancer, what you can take so that before treatment, during treatment, and after treatment, because immune boosters are very important for everybody to take so that you reduce the chance of getting cancer. And of course, you've got to attend there. You'll be able to be taught about which are immune boosters. I know, and this is for the doctors now. Doctors, we are not very good at diet, except when we are nutritionists. And I know Dr. Ndiritu here is not very good. When you go and ask about diet, he will refer you to a nutritionist. We have got so many doctors. They are talking about what you need to take, the nutrition, and the way Dr. Ndiritu has said that you are taught not to eat anything. You have got cancer and you are taught not to eat anything, and the diet given is very important. If your patient have got cancer and you also want to prevent yourself from getting cancer or to delay the cancer coming, you need to talk to a nutritionist who is trained, who is qualified. He gives you the right things to do. Don't go to any other quacks. They're outside who talk about nutrition when they're not very, very, very good. I know every pharmacy nowadays, and there are pharmacies nowadays which are selling immune boosters. We have got so many network companies which are selling immune boosters. My comment is one, on my opinion. Whenever somebody sells you immune boosters, just buy them, take them, provided they come from reputable companies, and you can Google and get that company. Of course, there are so many traditionists, and this, let me comment this last one because I've seen a lot of it. There are so many people, they've got cancer, and they go to take ample medicine. I think Dr. Ndiritu should expand on that. I'm sure you've seen a lot. Those patients, when they've got cancer and you go to herbalist, they say that my grandmother and my great-grandfather was treating cancer using trees and whatever it is. As personally as a doctor, I don't recommend that. But I normally recommend food supplements which are normally very good for your health. Lastly, my comment. Whenever you are doing your birthday, ask yourself, whenever your birthday comes, how many birthdays do I want to see when I'm alive? And have I screened for my cancers? For the young people, When you are doing your birthday and your parents are there, remind them during your birthday, my parents, grandparents, is important during your birthday. Remember to remind them to go for their screening for the cancers which are screenable. Thank you.
Oh, thank you so much. A round of applause. So that's a challenge to all of us. We are all advocates. We've been able to get the quality information, and knowledge is power, right? So I believe you're going to extend that invitation to even the people within your family setup and even the community as a whole. Are we promising that we're going to do that? Yes? Thank you so much. Thank you so much, panelists, and you can have your seats. So a round of applause. Amazing job, amazing job. They are still around in case you have a question that maybe wasn't responded to. Feel free to reach out to them, go to the different tents and get support. And I know that is going to enable you to become a better champion around cancer, around treatment as a whole, right? So without much ado, I want to invite the MC for the day. So help me invite, you clap once. Help me invite. Help me invite. Help me invite. Moses.
Thank you. Thank you. Round of applause for Mercy and the entire team for doing such an amazing job. You guys have sat for too long. Please stand up on your feet. Let's go say hi to your neighbor. Say at least to around how many are we here? We're like 27. Please say hi to 27 people around you. Tell them, give them one lesson you have learned today. Tell them, share with them one lesson, one takeaway home. One takeaway. At least get one takeaway. You know, what have you learned? What have you learned? You know, yes, share something. Just share one. Don't just say hi and keep quiet. No. Introduce yourself and tell them, I've learned this and this. And I'll ask somebody to come and tell me what they have learned. Somebody tell me, go for screening during my birthday. How do you do my birthdays today? Yeah, sure. Texas Center. Abu, can you move around with those lovely jackets of yours? I want you to move around. I want you to interact. Say hi to at least 20 people. Tell them one thing you have learned. No sitting down until you've shared like with 20 people. One more minute. One more. Chairman, you should be moving around. One more minute. Move around. Move around. Move around. All right, thank you very much. You can be back on your seat. Before we sit down, I want to do one activity. First of all, let's appreciate the convener of this meeting. That is Mr. and Mrs. Jerry in the house. Please give a round of applause, Mr. and Mrs. Jerry. They have been so passionate and relentless about this. Thank you very much, Mr. and Mrs. Jerry. We really appreciate. Help me appreciate the angel of the house. The angel of the house, that is Reverend Virginia Nganga. Virginia Nganga, please, round of applause for the angel of the house. Also the pastor, the main pastor of this house. And also the resident pastor, Pastor Paul Githai. Pastor Paul Githai, are you around? Pastor Paul Githai? All right, thank you, Pastor Paul Githai, for opening up the opportunity for us to come and just learn and grow and build capacity. Now, before we see, let's do a fun session together. Let's see, it's more about wellness, all right? And wellness, you have to be becoming fit. You have to make sure that you are ready. Your what are they called? Your enzymes are activated, okay? So I don't know if my DJ is ready with the music. I want to do just one activity and then we are good to go in for 3 to 5 minutes and then we are good to go to the next session, which will be very interesting. We're going to be learning about wellness and nutrition. Tell your neighbor, wellness and nutrition. Ask your neighbor, did you work out today in the morning? How many steps did you do in the morning? Did you count your steps? Do you normally count your steps? Do you know that? Do you know a BMI? All right. Have you been checked? So please, after this, there are exhibitors outside. I can see there's Equity Afia, there's Omega Opticians in the house, there's Texas Cancer Center. There are myriad of our sponsors and partners. Big up to them. Please give them a round of applause for enabling us to come to this opportunity. All right. So after this, kindly please take some time and go and visit, as most of the doctors have said. Dr. Obonyo, Dr. Nerito, and Dr. Mutuma have urged us, please, let's go and get checked. Are we together? All right, we are ready. DJ, are you ready? All right, let's do this. Everybody, now we are tunatoa baridi. Give me some more volume. Some more volume, DJ. Everybody, give me your arms up. Everybody. Take it down here. Take it out. One more time. Take it out. One more time. Take it out. Again. Step on the enemy, step on. One more time, put it. Hey. Again. Hey. Put it down. One more time. One more time. Are you ready? One more time, let's go see. Take it out. One more time. Again. Heighten your neighbor. Heighten your neighbor. Heighten your neighbor. One more time. Point to your neighbor, point to your neighbor. Point to your neighbor. Hey. Now I want to take it down like this, like this. How low can you go? How low can you take your neighbor? Hey. 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 Go to the neighbor. Go to your neighbor. Hey. One more time, let's go. Take it up. Take your hands up. Again. Clap your hands. Clap it up. Clap it up. This is the last song of the day. This is the last song. Are you ready for this? Now, like this, let's go. Change the other side, oh. Come on, come on, come on. Hey, pull it here, pull it here. One more time. One more time. Step it up. Hey! 1, 2, 3, let's go. Take it down. One more time. One more. Take it up. Just it. Anybody can do this. Anybody can do this. One more time. Are you ready? Are you ready? Are you ready? 1, 2, take it out. One more time. Pull it. Take it out. One more time. I can't see those hands going up. Chairman. I can't see. Pull it. Move around. Are you ready? Hey, move around. Come on, everybody. Here. I put it up. Take it down. Take it down. Take it. Relax. DJ, thank you very much. Take a breather. Give a neighbor high time. I didn't know you're such an amazing dancer. I didn't know that you can be paid to dance like this. Hey, thank you very much. Have your seats, everybody. So, as I mentioned, this event is courtesy of Epic Events. That is the convener of Mr. and Mrs. Jerry. Thank you very, very much. And I hope you guys are getting educated, getting informed. I actually came with my notebook. Let me breathe. You guys mehema kama mimi. I actually came with my notebook, and the reason why I came with my notebook because there were so much important nuggets that I was learning that are timeless. You know, some of the doctors here are very seasoned, and they have knowledge and capacity to really give information that's very credible. All right? So for you to have such and to get such information for free, some other places you have to pay like over 5,000 shillings to get information like this, to sit in such an auditorium and get information. But we have the privilege of sitting and learning and getting knowledge, all right? So please take advantage, all right? Take advantage of such an atmosphere. Take advantage to make sure you go and visit all our sponsors and partners so that you can get more information on what it matters and what your health matters a lot. What matters a lot is your health, all right? So please get time to visit them and get info that can help you grow and build capacity. All right, so other than that, I want to introduce our next panelist. Are you guys ready? Are we ready? All right, so we're going to be learning more about wellness and nutrition. And to invite on this microphone, to invite the moderator, the capable moderator by the name Scholar and Jerry. Round of applause for Scholar and Jerry just to come and take us through one or two things, and then of course she'll go ahead and invite her team of panelists. Thank you very much.
Praise the Lord. Good afternoon. Najua hatujakula lunch, lakini the information that we have should make us have energy, right? Good afternoon. Praise the Lord. First and foremost, I want to honor God for giving us the opportunity to be here, to thank the father of the house for allowing us to get all this information that we're getting. And I don't know, sijui kama imewa hit vile Mose amesema, the wealth of information that we have in this place. Do you know, just securing a consultation with one of these doctors, they can tell you, you will not pay less than 5,000, right? How many specialists do we have around? More than 5. So for example, tufanye tu quick calculation, we have like the first panelist of 3, right? And then now we're going to have a panelist of 4. That's 7 times 5. How much is that? 35,000. That's how many hours are those? First of all, we have saved your time and your money, right? Another thing, you also get the advantage of screening for free. Oh my goodness. If I were you, in my heart, I would not be checking the time. I would be checking the information that I'm getting today. Amen. Praise the Lord. Please, me, by the way, msiponiongelesha tutaongea, itabidi tumeongea. We are here to learn, so I expect questions. Mimi, I am tackling the sector of wellness. Don't see me slim and think I am fit. You know, that is how we interpret it. Sindio, unaona ati mtu juu ni mnono, huyo hayuko physically fit. Sindio, ama unaona huyu ni mkonde anaweza, hey, you know. So those are some of the myths that we are here to decode and to learn. And we have wealth of information. We have what? We have wealth of information. And so right about now, I want to invite the first doctor that I'm going to call to the panelists. I'm not going to really introduce a lot about them. They're going to talk about it when we get to the panel discussion. Because of time, I want us to take most little time possible, so that people can have enough time to go and probably get tested outside there. So first off, I'm gonna invite, I didn't say what I do. Do you want to know what I do? Yes, so my name is Scholar Wairimu. Nimebatizwa leo Njeri, sikuwa najua niko na hiyo, but it's fine. I am Scholar Wairimu. I am born again. I fellowship at JCC Parklands together with the organizers of the day. And I am an aesthetician. Who can tell me what an aesthetician does? Who can tell me? Just take a wild guess. You don't have to get it right. Thank you, beauty. So me, I am a lover of beauty, and I have background in nursing. So I didn't know how both would merge, but God has a way of doing things. So aesthetics is beauty and nursing merged. So what do we do there? We use medical procedures to help correct some of the chronic conditions. For example, we have things like acne. We have things like scar management. We have things like, okay, wacha nisiseme hiyo, mtaanza kunipoint hivi, nyinyi ndio mnafanyia watu ile kitu. But if I could talk about something like gigantomachia, the people that struggle with enlarged breasts, right? We help to boost their confidence back. So there are very many things that we do in that. So ukitaka kujua zaidi, you can see me as well. And so right about now, I want to invite our first panelist. Our first panelist is Lilian Mbao. Lilian Mbao is a global health leader, preventive cardiovascular medicine specialist, an avid researcher, and a certified cardiac rehabilitation expert, fitness enthusiast, World Heart Federation, University of South Wales. So without further ado, ladies and gentlemen, put your hands together as I invite Lilian. Come on, put it together until she gets there and has a seat. The next panelist I'm going to invite is Dr. JJ. Nimeona ameandikwa Dr. JJ. Lazima kuwa ni Gen Z. So atatuambia who he is. I don't want to introduce him. So atatuambia who he is so that I don't take a lot of time here. Put your hands together. Come on now. Tusikue wachoyo na the clubs, and they will hawatakuwa wachoyo with the information, right? Yes, so next on my panelist, I have Dr. Stephen Ayere. Kindly put your hands together for Dr. Stephen Ayere. And last but not least, I have Winnie Athiambo. Kindly, Winnie, karibu sana. Put your hands together for Winnie. And I also want to make this session as interactive as possible. I don't want us to take a lot of time. We have taken a lot of time in the first session. So if you could be getting your questions ready, if you can be able to note it down and maybe pass it over so that we can try and speed this up so that we can be out of here in a few minutes. Sawa sawa? Yes, thank you. Thank you so much. You can be asking your neighbor if they have a wellness question as we start off. Cindy, yeah, so I'm going to start off with Dr. Lilian. Yes, kindly you can start off by telling us who you are, what you do, and what you stand for, and then we will proceed.
Good afternoon, everyone. I hope you can hear me. So I'm Dr. Lilian Mbao. In summary, I'm one of the few doctors who focus on prevention. I know many doctors, they will diagnose you, give you medication, but for me, we focus in the space of prevention and health promotion, and I'm excited to be here. My area of specialization is prevention of heart disease. So in case you didn't know, in the whole world, what kills most people is actually heart diseases. It's actually heart disease, and maybe in Kenya it's not the case, but soon in the next few years, heart disease is going to actually be what is killing most people. And heart disease, we know, includes things like strokes, things like even hypertension, which is a risk factor for heart disease, includes things like heart failure, heart attack. So these are I focus on helping people to prevent and to keep their hearts healthy. So I work for an organization called CardiHub, and I'm happy to be here.
Thank you so much. Put your hands together for Doc. On to our next doctor on my right. Kindly tell us about yourself.
So, good afternoon. I really like that we have someone dealing with the matters heart. So maybe you can tell us also later if heartbreaks will fall there.
Thank you.
Yeah, but so my name is Dr. John Jack Omondi. I serve as the head of technical services at MSI Reproductive Choices, which is an affiliate of the greater MSI in London. So here in Kenya, MSI, we have mainly 3 pillars. So pillar 1, where we deal with our programmatic work, dealing with government, the aspect of health system strengthening, where we capacity build the medical officers, clinical officers, nurses, with matters reproductive health in women. So we are the largest providers of family planning in Kenya. So that is pillar 1. Then we come to pillar 2, where we have our Maristops clinics. We have 16 Maristops clinics, and that we have 15 core clinics and 1 maternity center based at ENH. Then we go to pillar 3, where we have our products, for example, misoprostol, which is very key in the management of postpartum hemorrhage and also the induction of labor. So welcome all of you, and I'm really glad to be part of all of us here.
Thank you so much. Thank you so much. Put your hands together. Next, on my left, I have Dr. Winnie. Kindly, could you introduce yourself and tell us what you do?
Good afternoon, everyone. Good afternoon. Good afternoon, everyone. Yeah, my name is Dr. Winnie Adhiambo. I work for Evolve Well Healthcare. So we are located at Kiambu Road. We are more into wellness and also just obesity management. So typically for us, we look at obesity and wellness holistically. So starting from the nutrition bit and also just looking at exercise, the day-to-day exercise. The discussions to do with your BMI and how sedentary life affects your weight gain and how you can be able to manage that. So as we approach obesity and also approach weight management, typically I'll call it weight management. Yeah, there are people who also want to gain weight as much as there are people who want to lose weight. So as we manage that, we look at it holistically. It's a 360 approach in regards to weight management. So currently there are medications that are available to also support with weight management and obesity, because obesity currently is being handled just the way you'll handle diabetes and hypertension. And if obesity is not well handled, definitely you'll get to diabetes, you'll also be able to get to hypertension and also some other cardiac diseases. So we look at it as a holistic approach, because there's a client who will come in and you'll be able to check their BMI and say, for this, I'll be able to prescribe nutrition and also be able to prescribe exercise, where we have a fitness specialist to be able to just guide and craft a way that you're able to just do the exercise and be able to get your ideal weight. So it's a 360 approach. Before you get to the medication, we advise on nutrition, then advise on how you can exercise and do your day-to-day fitness exercise, then now come in to you being able to see the obesity specialist. And definitely if you are a client who can be able to get the medication, that's a BMI of 30 and above, then it's prescribed and it's doctor managed, in that you walk the journey with the doctor and you are able to just get to your ideal weight. In the process of that, we teach habits, because it will come to a time where you will stop the medication. So what happens? We want to teach you on your relationship with food, how you do your exercise on a day-to-day basis, because actually if you don't exercise and your life is sedentary, you'll actually gain back the weight. So it's more of teaching on the habits so that you can still continue with the lifestyle even when the medication is not being used at that time. Thank you.
Put your hands together. Sorry about that. Yes, go right ahead.
Good afternoon, everyone.
Good afternoon.
Thank you, the organizers of this event. My name is Stephen Ayere, a clinical nutritionist and also a fitness enthusiast. And I'm really, really happy because on stage there are team actually that are doing basically what we do. I come from Avenue Healthcare, so I do clinics here in Garden City for nutrition services, majorly clinical nutrition, and I major on patients who have metabolic issues. And nowadays I'm developing also interest in digestive issues. So when you look on our daily life or our daily activities, as our topic even for today, somebody mentioned your health is your wealth. So if you are not investing in your daily activity, like for instance today, if suppose you have eaten a food, maybe to me that is more like a deposit. So have you deposited in your body or have you withdrawn in your body? So I look food in that aspect, more like an investment in your body. So what I do, and I find it satisfying doing, is helping those patients with metabolic condition, trying to work toward reversals, at the same time trying to work towards reducing the pill burdens on them through simple dietary measures and lifestyle changes. So I'm really happy to share some insights with you today, and I'm really looking forward for more interactions from you. Thank you so much.
Before you drop the mic, sir, you can actually start us on. You know, most of us, when you hear the word exercise mentioned, your mind goes to the gym. And the gym is not an easy work. We can all agree, right? You need to have time. You need to have money to get the kit, right? So what are some of the exercises, if I would want to start the journey? What are some of the exercises, even if I don't need to go, that I don't have to go to the gym to do, that I can start at home?
Yeah. So this is most common question that I usually get in the clinic. And it has some factors to consider, because some people, maybe they have been recommended exercises by the specialist. Maybe you have gone to one of the centers, they have they have told you, go and lose weight. And one of the way to lose weight in your mind is to exercise, and in your mind is to go to the gym. And we know so many people have paid subscription fees, and they let them sit there in the gym because there's no motivation about it. Sure. Yeah, so when you think of exercise, to me, it's something that targets almost 70 or 80% of your body muscles. Because somebody will say, I'm exercising, I'm counting the steps. We have been asked how many steps you have done throughout the day, but I can do 10,000 steps in a day, but I'm just moving from here to there. Small steps, but is it continuous or is it something that I'm taking pause on? So when it comes to exercise, I need something that is challenging or straining or giving you to challenge your muscles. So you don't need like a gym, like a whole facility to do the exercise. But of course, if you are motivated, you have the resources, subscribe to the gym, you'll get so much people to support you there. But if you're disciplined enough and you have space in your house or even space in your room, even in your bedroom, you can do some activity. Something as simple as you lying down flat and standing up as fast as you can safely. I'm sure you can't do that 30 times by just lying down and standing up. You see, that is a whole body involvement, a kind of exercise. So you're involving all your muscles in the process of just getting down safely and standing up as fast as you can, even in helping your mental health. So you don't need equipment, physical equipment, for you to say that you're exercising. And people tell me they walk to work every day as a form of work. To me, I tell them that is not exercise. Exercise has to be intentional. Exercise has to be specific time set aside for you to exercise. That is just being active, and we usually advocate for active lifestyle. So you going to work, you have to go to work, yes. Right? Yes. So that is part of you being active. You need to go to work. So it complements to the exercise that you'll set aside time. Maybe let's say when you're coming from home, now you time yourself. I usually walk 20 minutes for 2 kilometers. Can you time yourself by the time you're going to the house? I'm doing 10 kilometers. Now that one you're being intentional and you're using it now as a form of exercise. But just walking alone is good even for the heart. Dr. will tell us here. It's good for your cardiac health. So exercise has to be targeted, exercise has to be intentional, and you need to motivate yourself. You don't need a whole facility like a gym for you to say that you are really exercising. So that is what I can say about it.
All right, thank you so much. Put your hands together for Doc. My next question will go to Dr. Winnie. Now, how far is too far? Like, how do I get to the point to know that, hey, now this weight is too much, you know? Because sometimes we wait to a point where you're going to the hospital and you're being told, now you have to lose this weight. But me personally, how can I regulate it? How would I know? Or is it important to do BMI? How would I know that according to my body, this is the limit?
Okay, so typically, when you walk into our facility, what we do, nowadays we don't use the normal weighing scale that probably you'll go to most of the clinics and probably healthcares and get it there. So we have a different type of machine where we do something called full body analysis. So how does a full body analysis work? So typically, if you want to check, like if the weight is overweight or probably where the weight is, there's something called a BMI. So a BMI is your weight versus your height. But there are also other arithmetic measurements that currently are used to probably check on your weight increment. We do an analysis of the hip and also waist analysis when you come into the clinic. So typically, when we do your BMI, a normal BMI is between 18.5 to someone who has a normal BMI till to 24.5. Anything 25 till 29.5, I'll give it as overweight. Then obesity starts from 30 and above, of which it's also classified as obesity class 1, obesity class 2, and onwards. So typically, when you do a full body analysis, today we are out there, we have the machine. So it's connected on the phone and you're able to just get someone's full body analysis. So the measurements that comes out from the full body analysis, you're able to check your weight, your BMI, then it's also able to analyze your adipose fat, because the adipose fat is a good measurement to just be able to analyze. Then, other than the adipose fat, we are also able to check your visceral fat. So those are some of the measurements, including bone mass, your water level, your muscle levels. So generally, in terms of the weight loss program, we are looking into someone gaining muscles, building muscles, and losing fat. So when you come in and probably we start the program, either way, probably if it's medication or it's you doing the exercise, the parameters that we'll get like today, generally we'll do an analysis after a month to just check on the progress that you have. So we'll be able to check. When we're on the weight loss program, we want you to lose fat, not the muscles. Yeah, the fitness specialist will tell you, when you go to the gym, ideally you need to build muscles. And building muscles, most of the time they'll prescribe strength training exercises. So you need to build muscles and lose the fat. So typically in regards to the BMI, it's an analysis used to check that. Then we'll also be able to do analysis in terms of because most of the time the fat will accumulate around the waist and around the hip area. So there are ranges that are normal for both men and women in terms of the analysis for the waist and the hip. Plus also we do an analysis of the waist-hip ratio to just be able to check. But it's different with the African people compared to the Caucasians. So we have ranges that are there. We'll be able to analyze, then be able to walk the journey. So if someone is overweight, we'll prescribe nutrition and exercise. But if someone is obese, and also there are other complications that probably this person will have, probably issues to do with the heart. At the same time, if you do a lipid profile, you'll be able to analyze the lipid profile completely to be able to advise on what they need to do. So it's a 360 approach in that you look at the lipid profile, you look at their analysis, and just be able to prescribe and see what is what. So being overweight, at least it's an alarm. You've already told this person, your BMI is between this and this. We need to put it to the normal weight, which the BMI is 18.5 to 24.9. So someone who is already overweight with probably other comorbidities, you'll be able to also advise. And with these medications that are currently there, you'll even get a client who, if you check their HbA1c, you'll be able to see that probably they're already at the point of their HbA1c being high, and they're almost getting to diabetic state. So throughout the program, and also just being able to go through the program with the obesity specialist and the physician, at times after use of this medication for like around 3 to 4 months, you get that the HbA1c has been reversed. So typically these medications have also been identified to be good for the heart, for the kidney, and also if it's something that is able to reverse someone's HbA1c to a normal HbA1c, that is something that is worth doing. But what we really like try so much, I know you've heard about the medications that are out there, the semaglutide, the GLP-1s, the semaglutide and tirzepatide, is when these medications have come in and they are helpful, but now there are people who are abusing it. It needs to be doctor-run program, and there are specialists out here who are able to run the program with you. It's a prescribed medication. It's not something you go to buy over the counter and prescribe yourself. So there are people that medication is useful for. Kindly let's not abuse them so that we have these people benefit from those medication. If you come to our clinic and you are overweight, we'll prescribe nutrition and exercise. We'll not prescribe the medication. Because as per WHO, obesity, like we give it for clients who have a HbA1c, for clients who have a BMI of 30 and above, and probably we'll also check other comorbidities, or you'll also check what has this client tried to lose weight before, like just saying I'm prescribing the medication. So they are helpful for other clients, the people who have cardiac issues at night, they have apneas and all that. So they are helpful to such clients. So we try so much not to abuse it, to only use it for the clients who needs it. So it's not a medication we want you to go to the pharmacy and take because you want to lose weight and fit into your nice gown within 2 months. No, it's specifically for clients who will gain from it. Yes.
Wow, thank you so much. I don't know if you guys have had, there's so much myth around the semaglutide, and now that you have had it, now let us not just criticize. Let us talk about it from the point of knowledge. Sawa sawa. And I don't know if you guys got something. What our 2 doctors told us about wellness and weight has now trickled down to heart conditions, right? And so now I want Dr. Lillian to tell us how weight and exercise is relevant to some of these conditions and how they can help, how this can help us manage.
Okay, thank you. So let me start by saying, so when you look at heart diseases, there are different types. Majority of heart diseases are related to our lifestyle. But there's another group, I will not talk about them much, like congenital. I think you've heard of congenital heart disease, where a child is born with a heart disease. Those ones are not. But the majority, up to 80%, are linked to our lifestyle, how we have been living our lives. And that's where I want us to focus on. So how do we get heart disease, and how is it related to our lifestyle? So there are many, what they call risk factors, which make you a candidate or increase your risk of heart disease. So one is what we've talked about, the obesity, or having a weight that's not normal. Okay, and further than that, it is a weight that is distributed in the abdomen that is even worse. Okay, so you're overweight and a lot of your fat is distributing around the abdomen. It's called visceral fat. That means the same fat deposits are in your organs and in your blood vessels. So number one is having a weight that is abnormal, overweight. Okay, and even worse if it is around the abdomen. The second thing we've talked about is exercise. So you're not exercising, you're sedentary, meaning like what we are doing here, we are sitting down the whole day in the office or at home. That's the second thing. We are what? We are not exercising and we are sedentary. The third is alcohol. Taking excess. Actually, alcohol has been shown not to be. I know before they used to say a little alcohol is good, but now we are saying alcohol has no benefit and it can predispose you to getting heart disease. The fourth one is smoking. So if you smoke, again, you're increasing your risk of heart disease. The fifth one is mental health. Very important. It's been shown that mental health conditions like anxiety, depression, actually increase your risk of developing heart disease. So again, we need to be very vigilant. We should normalize, getting checked for mental health problems, because if we don't, then we increase our chance of heart disease. The other one, very important, nutrition. I think the earlier panel talked a lot about diet. So diet, and when we talk about diet and heart disease, number one is salt. So we are taking too much salt in our diet. That causes us to get high blood pressure, which increases the risk of heart disease. The other thing also said in the previous panel is excess sugar, excess carbohydrates. What that does, again, it makes us get our weight goes up, but also you also increase your chance of getting diabetes. Diabetes is also a risk factor for heart disease. Okay. The other thing is vegetables and fruit. When we don't take enough fruits and vegetables, also we are increasing our risk of heart disease. And the last one I'll mention is fats, unhealthy fats. I know it's very controversial, but it has been shown that there are certain fats, especially the ones in processed foods, the foods you buy in the supermarket which are packed, they have unhealthy fat, and then also animal fat. So excess intake of animal fat from animal sources, like red meat, butter and all that. I'm not saying we don't take, but if you take it excessively, it can also now increase your risk of getting a heart disease. So all these things, as you can see, are how we are now talking about obesity, we are talking about exercise, we are talking about nutrition. So what these things do, when we do these things, our lifestyle, we develop hypertension, our blood pressure goes up, we develop diabetes, and we develop high blood cholesterol. So you have a lot of unhealthy cholesterol in your blood. Now, what these do, they start blocking your arteries, your blood vessels. What is the purpose of your blood vessels? To supply blood to your organs. So if you're blocking the blood vessels that are taking blood to your organs, what happens? So for example, a stroke. How a stroke happens? The blood vessels that are supplying blood to the brain progressively start getting blocked, and one day they block completely. That's how people get a stroke. A stroke is basically part of your brain. Majority of strokes, there's a different type of strokes also, the one for bleed, but I'm focusing on the one for when the blood vessels start getting blocked. So at some point, the blood vessels block completely, and your brain, part of your brain dies, and you get a stroke. That's how people develop stroke. If the blood vessels in your heart, the ones which supply blood to your heart, start getting blocked, that's how you get what we call a heart attack. And you find a lot of people collapsing. He just collapsed and died. Many of those people actually could have developed what we call a heart attack. And there are many other heart conditions which can result like heart failure. So that's basically how all these things cause heart disease. Now, what we do as preventive cardiovascular medicine experts, we look at you holistically. So when you come to us, we don't just focus on your blood pressure, we don't just focus on your diabetes, we don't just focus on obesity, we look at all these things. So when you come to us, we'll take a very good history, we look at your diet, we look at your weight, we look at your blood pressure, we look at your diabetes, we check your blood cholesterol, we check your mental health, we check your physical activity. So we look at all these things because all these things together are the ones which increase your risk of developing a heart disease. And then now, based on what we find, we work together with other specialists to come up with a plan for you. And that plan has both medication and it has lifestyle changes. So we come up with a plan which includes medication for those who have high blood pressure, they have diabetes. When it is advanced, you have to take medication. Of course, when you come early and when you have high blood pressure that's not very high, and we assess you, or diabetes and it's still borderline, or it's the HbA1c is not very high, you could try lifestyle, especially if it's diagnosed early, lifestyle alone. But there are those who come late, and they definitely have to start on medication together with lifestyle. So we do an assessment, and we let you know, okay, for these parameters, we have to start medication. For these ones, you're going to do lifestyle. And we follow you up, and we help you to address all these risk factors. So basically, in a nutshell, that's what we do. And I just wanted to add on the exercise part, just to how much exercise should we be doing. So the guidelines say that you should do at least 30 minutes most days of aerobic. So aerobic exercise which makes your heart rate go up and makes you breathe faster. You start sweating. So you should do at least 30 minutes on most days. You can do more. This is a minimum. You can do more. You can do an hour, you can do two, but minimum aerobic every day, 30 minutes at least every day. And then you also need to do strength training. So the guidelines say that strength training, you should do at least 2 days a week. Minimum, you can do more, you can do daily. But minimum 2 days a week, strength training. Now, we may not go into the details of what strength training is. Of course, you can use weights, but there are also other ways of doing strength training which don't involve weights. You can do them at home, and of course, our exercise experts can guide you on that. And I want to emphasize that as you grow older, your muscle starts reducing. So it's even more important as you grow older that you do strength training exercises at least 2 days a week, and also balance exercise, the exercise which improve your balance. Because if you're elderly and you fall, you really have a high risk of complications. So exercise and balance, especially as you strength training and balance exercises at least 2 days a week, especially as you grow older. Lastly, before I stop, if you have a heart disease, it doesn't mean you stop exercising. We are able to prescribe safe exercises. So you may have had a heart attack, you've had a stroke, you have heart failure, you should still continue exercising. So when you visit a specialist like us, we'll be able to assess you and actually guide you on how you can do exercise safely, even if you already have a heart disease.
Wow, that's a whole consultation right there. Put your hands together for Doc. I am still in awe. Wow. Okay, so, wow. I don't know, Muna absorb all that information. We absorb and then we will go to digest at home. Where? Okay. So now, Doc, let's start off with Marie Stopes. Marie Stopes is huge about reproductive health, yeah? And reproductive health is a huge part of our lives. So some of these things, I don't know, tell us a little bit about the background of the origin of some of these things that affect us later in age, and are there some signs that you can be able to see, and are there some signs and tests that could help you to avoid some of these, like infertility and PCOS conditions later in life?
So thank you so much. So number one, when we talk about sexual and reproductive health, everyone antennas will be raised, and the group that will feel so much affected is the women.
Yes.
So when you visit us, and also in the government perspective, you'll find that we are dealing mostly with women. But during this encounter of sexual and reproductive health, the women are not alone.
No.
The men are involved. So the aspect of male involvement comes in, and it's also very important. So when we talk about SRH, so we'll have various parts.
Yes.
There is the aspect of prevention,
Yes.
of which our first panelist really talked about it, and I will still touch on it. We have the aspect of healing and curative services, and also post the healing, how do you carry on with your life? So when you look at, we'll start with the woman. So we have the stages of a woman, and we serve women at every stage. So you look at that little girl when they start having their menses. Who is there to guide them? We can have them here at the urban, at the peri-urban centers, and also at the rural centers where the situation could get worse. Then that little girl is also at risk of sexual and gender-based violence, and that also needs to be addressed. So you'll have questions around these areas. Then we are still following the journey of this girl. They'll start having sexual encounters, and you'll need to protect them as well during that phase from diseases, from unwanted pregnancies, so that they can go to school and change their lives at home. From there, they'll have families. They will really want to have a quality family that they can take care of. They will want to prevent some diseases that can come in as a result of maybe having very many children. So there is that aspect. Then they transition towards womanhood. And you'll find people will not talk about women who are over 40. These are women who are having also changes in their hormones. And this is what we call menopause. So this group of women also need care. They also need to be protected from diseases that come in with regards to this. And that's why we have our cancer specialists on board. And you'll realize we have so many cancers that are related to women. For example, we'll start with what is ailing many women in this country, because we are still in the lower middle income country. And so we'll talk a lot about cervical cancer. And when you look at cervical cancer, for example, if you want to handle anything, you would want first to know who is at risk and what will really cause this cancer, because that is what will inform how we will prevent it, how we will cure it, and how we can even eliminate it. So the burden of cervical cancer is huge. February is normally dedicated as a month of cervical cancer. October is for breast cancer. So you can see how women are really taken care of. Tomorrow is actually International Women's Day. How are you taking care of yourself as a woman? In the prevention of cervical cancer, we have basic screening tests. In most of the facilities, in the government, also in the private, these tests are free. You have the VIA and the VLI before you even move to the pap smear that Doc was talking about. So there is that, and you can be screened. If you are in stage 1, you can be treated because you'll be referred appropriately. And even before we go to the screening, now we have the privilege of having the vaccine. And across our centers, we have the Gardasil, which will prevent the HPV virus. So why is the HPV virus important? And who carries this HPV virus? As a woman, do you give yourself that HPV virus? Who will give you the virus? It's a man. So we cannot just say that we shall give this vaccine to ages from 9 and above just for the girls. We'll also want to cut this spread. And so we'll target also the boys and the men, because they will harbor this virus, transmit it to the girls. And when you look at the risk factors, it's all around the HPV virus. So if we manage to control this virus, manage to eliminate it, consequently, we'll also eliminate cervical cancer. So that is just one aspect of illnesses that you can deal with, that surround the sexual and reproductive health of women. Going on to the reproductive side, we have antenatal services. And that is from the moment this woman realizes that they are pregnant. They really need to take care of this pregnancy. They do their 9 months, gets to the time of delivery. They need to do it in a safe way. After that, they will need to be protected as well, or continue being taken care of with regards to postnatal care. Here you have family planning services, because you need to give the woman's body to heal and all that. So we can talk the whole day with regards to sexual and reproductive health services, but we'll be addressing all these issues with regards to fertility. We'll be welcoming all those questions.
All right. Before you drop the mic, sir, you mentioned about healthcare systems.
Yes.
So, correct me if I'm wrong. These are what govern these are the bodies that govern how patients are going to receive the services and treatments, right? So does this include insurance policies and all?
So when you talk about healthcare systems, you see it is a whole system.
Yes.
So you have to focus on various aspects of that system.
Okay.
So you'll start maybe with the human resources. Who are these people offering the services? Are they qualified to offer the service, or are they quacks? Do they have the competency? Yes, you are qualified, but do you have the competency to offer that service? Will you offer it in a safe way? Will you see, here at Maristops, we believe in client-centered care. We believe that every provider has a duty of care to the client or to the patient. Because when that woman, that girl, that man comes to you, they have trusted you. They don't have the information. They believe in you. So you have a duty of care to that client. And you need to provide that care to the best of your ability. And that's one aspect, the human resource. Next, do we have commodities in place? If you are talking of family planning services, do you have them? If you are talking of post-abortal care, a lady is coming, bleeding, has lost their pregnancy. Do you have ways of taking care of that woman? Away from that, we come to systems of governance. Are there policies and guidelines that surround the sexual and reproductive health space so that this is what will guide us, this is what will form our Bible with regards to servings of our clients? So that is what we mean by a health system. And when we say health system strengthening, you're strengthening this across the board. Because I know each and every one of us has faced a challenge with regards to a particular aspect of that system that we are talking about. So that's the importance of health system strength.
So that means I need to, at least bare minimum, get information of the try and find out if this facility can take care of me holistically.
Yes.
Not just give me medication, but even follow up and aftercare, or if they would be able to handle me in specific situations.
Yes.
Are there maybe like websites where you can be able to know some of these things before you just make a mistake and go to a hospital? That's why you find people going to places and being given wrong medications.
Yes.
You go to places and a test is done and you're given wrong findings. You go to places and there is no proper care that is being given to these patients. Are there maybe, I don't know, maybe like a website or somewhere where there is public information where you can be able to learn about this system so that you can know how to go about it?
So that is a very good question. We realize Kenya is a tech-savvy country. We are the loudest on X, formerly called Twitter. We have that community called Kenyans on Twitter. You mess here, you will receive your backlash on X. And we have, right now, when you're setting up any business in Kenya, you have to make sure you have the online presence as well. Because this is where you'll get lots of questions, you'll get so many clients, because you'll realize, even here, as we are talking, you'll see people are on their phones, because people are constantly getting information. So also on our side, you have to make sure you have the most up-to-date information. So some of the website you can access, if you want, like for example, services at Avenue, you can just go first to their site, look at what they are offering, look at what everything with regards to maybe Equity Afya, at Maristops, you know we are the largest with regards to reproductive health. Look at how you'll be served. Right now, every facility has a call center, and most of these centers, the numbers are toll-free, where you can call for free. For example, at Maristops, ours is 0800 72 005. Call that at any time, you'll be given feedback. We also have a feedback system in most of the facilities, where if you have been served and a particular provider has not served you with regards to the standards that you expected, because we need to exceed the expectations of our clients. So if you have not been served with regards to that, you have an avenue of giving feedback. And feedback is the only thing that improves our services. Just the way we give feedback to government when they are not doing things right, they also need feedback. And that is the online space. So we have websites. Every organization has websites. Please make sure you get the right information. Websites with regards to medical care, we have Medscape, we have UpToDate, and many other spaces that you can get. So thanks.
Right, wow, okay. Now we'll not make moves without first finding out where we're going, right? And let's practice what we learn. Some of these things nobody will tell you, but at least we have the opportunity to hear it out today. I want us to finalize. Maybe we can have closing remarks. We can just start off with Dr. Steve over here. Just tell us, as you exercise, for example, if I want to gain weight, you just don't just exercise and not eat the right thing. So as you give us your closing remarks, is it important to watch what you're eating as you're exercising?
Yeah. So when we think of, as I'm closing, when you think of exercise, and I'd also like to add maybe one thing about reproductive health with also wellness and nutrition, because that is also very important. When you eat well, when you have, you go for wellness check, maybe you have gone to Evolve Wellness, you have done body composition analysis and so on, hormones has a role to play, and most of the hormones also cut across with diet and nutrition. So if you don't nourish your body well, you'll find yourself having also reproductive issues, low progesterone hormone, high estrogen, and so on. So also diet has to do that. And I mentioned early, I also develop interest in gut issues. So if your stomach is not well taken care of, every other thing that you're going to do is going to be out of nothing, or is not going to be beneficial. So in terms of exercise, when you exercise, majority of the mistake we usually do is we exercise, that is one stress you are giving to the body. At the same time, you're not nourishing this body, you're not giving this body what it deserves so that you can exercise tomorrow, so that you can exercise any other day. So rest is very important. As Dr. Ria said, you can exercise 30 minutes or even more, but how long are you giving this body time to rest, time to recover? Are you even nourishing this body? Because majority like exercising after work, you're already tired mentally, that is one stress. So you're going to add another stress to the body, exercise in the evening. So, and then you're going to spend there 1 hour, 2 hours, and then by the time you're getting home or you're getting in the house, it's around 9, you want to eat, you want again to sleep. So if you don't have a structured way of exercising, you'll find yourself in the same cycle over and over again, year in, year out, subscribing or having the New Year resolution goals. Every year, January, you are like, this year I'm now very serious. Because you're not getting the results, yet you're putting in the effort. So exercise is more like a science. You need to have time to recover, have time to nourish this body so that the muscles can be able to function well the following day when you want to exercise. I prefer exercising when someone is not tired, when you still have the energy to break down the glucose in your muscles, so that if your objective is to lose weight, you don't need, again, after exercising, use it like an appetizer. You're going now again to eat extra carbohydrates. You'll still gain back that weight. So when you exercise, go back, eat well as advised. Nowadays, no one shoe is fit for all when it comes to nutrition. You have to be customized based on your wellness goal or your weight goal. If you are to gain weight, more macronutrients, more carbohydrates and extra protein. If you want to lose weight, we customize based on carbohydrate intake, and the quality of that carbohydrate also matters. So exercise is very important, and I will urge every one of us, whether old, elderly, young, to always get moving, just be on the move. So in a snapshot, eat well, move more, and enjoy life, because that is the only thing that you are here, other than serving God. Of course, God is the main reason, again, to be alive or to stay alive. So eat well, move more, and enjoy life. Thank you so much.
Thank you so much. Put your hands together for Doc.
So typically, I'll just advise, in terms of obesity, it's currently a disease. So anyone who is obese is not lazy. We need to know about that. So if you look at probably anyone around you or anyone around your family, you'll get that these people probably, they've tried everything. But if you come to Evolve, we also look at other things that may make someone, like you've tried the exercise, the nutrition, and still the weight isn't going away. Things to do, like if someone has a thyroid disease, like hypothyroidism, their metabolic rate is very low. So as much as they'll do everything, they will not be able to lose the weight. You get that hormonal issues in women, they're a contributing factor to weight gain. Things to do with like stress. As much as you try, the cortisol hormone, once it's high, you'll definitely still have the weight. So generally it's a 360 approach. Let's not stigmatize people around us. It's not that someone is lazy. You'll get that they've tried everything. And you see, before, probably people would come with obesity. You'll just tell them nutrition and exercise. Yes, there's nutrition and exercise, but my appetite is up. I want to eat this. I want to eat this. It's not as easy as we all think. So that is why there's help to just try and walk the journey with these people. So what I'll really advise is like habits are very, very necessary. Your day to day. So in terms of weight loss, it's calorie deficit. Like on a daily basis, let's say you eat all your meals very well and you have your cravings, but you sit in a matatu or probably your private vehicle, 9 to 5 job, we are seated at work. Walking around will not be an ideal exercise if it's not intentional. So definitely with time, you'll get that probably within 2 or 3 years, you've already gained like 10 kg. So as you try to change probably your habits, just incorporating exercise into also your day-to-day routine is really very important. As much as you try to like do food selection in terms of the nutrition. So in terms of nutrition, mainly carbohydrates, if like, you see in normal, like most of us, the way we were raised, if I even come to your house now and you're served, if your plate, probably the portion that we advise as per the nutrition, if you put for me small little rice, I'll be like, hey, huku nimenyimwa chakula. Typically, we were told that the rice need to be a larger percentage of the plate. Then the protein, you'll get that it's small, then there's the vegetables. But if you talk to the nutrition experts, they'll tell you, typically the protein is what will build the muscles. For the carbohydrates, definitely it will be stored to fat, and the sugars also will be stored to fat. So typically we need to change on that. And obesity is a disease. There's help. Come in and get your full body analysis checked. Come in and have a routine for the nutrition. Come in and also be able to just get some of the exercises that will help, even before we get to the medication bits. But there are medications that are out there, doctor-run program to be able to assist in just being able to get to your target weight. And even as you get to that, we are not just saying it's only the medication. No, that will be wrong. Because even for the clients, probably for the patients who are doing the weight loss program, we look at it as a 360 approach. When you're on the program, we need you to lose the fat, not the muscles. For the orthopedic team, they'll tell you, muscles are very important even as you age. So that's why the strength training is there. Then we'll advise on protein-rich food and tell you to reduce on carbohydrates, do well on your vegetables, and hydration is key. So take that home, and obesity has help. Like if you're obese, you'll get help. Come and get help. So let's not stigmatize. The people who are obese, probably they've tried everything. Don't look at someone and say, hey, they're big. They're not doing anything. They're lazy. No one is lazy. They've tried. Thank you.
Thank you so much. We can have the remarks from Dr. Lillian, kindly.
Thank you. So without having to repeat what they've said, what I can say is when you reach 30 years and above, it's a good time to have a thorough cardiovascular or a heart risk or cardiovascular risk assessment. So have your cardiovascular risk checked. This will involve checking your blood pressure, your blood sugar, blood cholesterol, diet. Your diet will be assessed, your weight will be assessed, your physical activity levels, mental health, if you smoke, if you drink. So have those. It's important when you reach 30 and above, have all this checked and addressed, because your risk of heart disease is actually keeps increasing as you grow older. I will not, let me add something, because tomorrow is Women International Day. So why should women be even more attentive to heart disease? So first of all, there are some heart diseases that affect women during pregnancy. I didn't talk about them, but pregnancy itself actually predisposes women to developing some certain types of heart disease. Secondly, it was mentioned family planning Again, there are some family planning methods which can increase your risk. They increase your blood pressure. Therefore, it's important that you have, you take this into consideration. Thirdly, mental health. It's known that women are at high risk of developing anxiety and depression. So again, another reason why, as women, we should be very keen about our heart health. I don't know which number I am in, but I'll talk about, it's been shown that if you've ever had a pregnancy loss, you've had a miscarriage, or you've had a stillbirth, you're actually at high risk of developing a heart disease. So again, anyone who's had a miscarriage, a stillbirth, if you had hypertension or diabetes during your pregnancy, again, you should be very vigilant. You need to keep checking, keep following up and getting screened, because again, you're also at high risk of developing a heart disease. So basically, and menopause. So what happens before you reach menopause? Estrogen, because what happens in menopause is the estrogen starts going down. Estrogen actually protects our hearts as women. So when we are younger, we are actually at lower risk of heart disease. But once we reach menopause and estrogen goes down, our risk of heart disease unfortunately starts going up. So again, another reason for people who are heading to menopause to just make sure they get screened and start changing their lifestyle so that they reduce the risk of heart disease. The last thing is our children. These habits start in childhood. These unhealthy diets we eat, sedentary lifestyles, poor coping mechanisms, stress management, we start them when we are younger. So it's important that as families, as our community, let's start getting our children aware of how they can protect their hearts, become more active, eat healthier diets, move more, have better mental health, so that they don't, develop heart disease future. Thank you.
Wow, thank you so much, Dr. Lillian. And finally, but not least, Dr. JJ.
So thank you all for listening to us. Number one, parting shot for me is that let's take charge of our health, whether it's nutritional health, all the way to my docket, the sexual and reproductive health. Take charge of your health, make use of the primary healthcare systems that we have in place as a country. And generally, let's just take good care of our health. Number two, I really like being an advocate of the women. Because when you look at this woman's life, and especially here in Africa, so today, this lady is not married. Who will we blame? The woman. They'll be like, wewe umeshindwa kupata bwana. Then fortunately they get married. What is the society expecting? Children. So if you look at the aspect of fertility, when a woman comes to me and says they've been in marriage and they're not getting pregnant, so there are simple questions you ask. One, are you getting your menses? They say yes. So that means they are releasing an egg and they have a uterus. So what's left? The sperm. Who has the sperm? Is it the woman? It's the man. No one will want to look at the man. So that is the second stage. Then the lady gets pregnant. She will do 9 months. Where will the man be? Probably somewhere in TRM, apiga sherehe, while the woman is suffering. Then she delivers. And now she would want to have control of her family. Who is responsible for family planning according to the society? The woman. Now they have 6 children. The man does not want to have more children, but yet they've put and heaped all this responsibility on the woman. So to our men, if you do not want any more children, get a vasectomy and give your woman that gift of International Women's Day and Mother's Day that come.
Thank you.
So that's, for the men.
You clap, ladies, please.
Yes. So let's all be responsible and take charge of our reproductive health. Let's support the women in our families, in our lives, and we will have a healthier society, a stronger society, if we support these women and these children that we have in our society. Thank you.
Wow, put your hands together. Who has a gift for Women's Day so that we can gift him? He has really advocated for women. That is amazing. Thank you even for enlightening us. Sometimes we lose track of that process, which is really meaningful. And we've come to the end of this panel discussion. Thank you so much for listening. I just hope and believe that we have grabbed a lot of nuggets, and there's a lot that we need to do personally before we even go to the health practitioners. So the prevention and everything begins with us. Sawa sawa. So thank you so much for giving us time. Thank you, doctors. Would like to hand it over to, okay, I want to ask before we close up, do we have any questions kindly before we wrap it up? Anyone with a question before we wrap it up, kindly? I don't want to close. Yes, there's one question over there. Kindly, if we can have a mic given to him.
Hello, everyone.
Hi.
Hello, everyone. My name is Duncan from Evolve Well Healthcare and Metropolis Star Labs. My question is to Dr. Lillian. You mentioned that as you're handling the cardiovascular issues, you advise on exercise and as well as medication. I wanted to understand what is the role of diagnostics in attending to your clients, and whether during the journey of handling the cardiovascular issues as related to weight loss, there is the space for diagnostics, that is the labs, including the cardiac markers, HbA1c and wherever. Like, what is their role and how do they assist? And are they continuous in the process of assisting the client? Thank you.
Chairman, that is another level of a question, but it is well. Anybody else? So that, okay, you have one more and then I give it over to the panel.
Hello. My question also goes to Dr. Lillian. Do you have those, are you screening or are you having tests like for cholesterol today? Or if you don't have, like, where can you advise us to go that is pocket friendly?
All right, over to you, Dr. Lillian. You have two sets of questions. I hope they have all understood. You have understood both?
Yes.
All right,
So,
and go ahead.
Yes, diagnostic tests play an important role. So when you come, depending on your age, depending on what other conditions you have, for example, if you already have diabetes, if you already have hypertension, so we establish where you are. So there are those who will have they have no other disease. They've just come for a cardiac assessment. So for those ones, we'll do a comprehensive assessment. So we'll do your full hemogram. It's important to know your hemoglobin levels. We'll also check your thyroid function. We'll check your diabetes. We'll screen you for diabetes. So normally we do the HbA1c. We'll do a urinalysis because that can quickly check if you have any kidney problems, and we'll do your blood cholesterol. So those are like the baseline tests we do for someone who does not have any symptoms. They've just come for a routine assessment. So those are the ones we do. But depending on if you have other comorbidities, so for example, if you've had hypertension for some time, you've had diabetes for some time, we may do other tests. Like for example, now we can do a full kidney function test. If you have a history of alcohol intake, we can do a liver function test. So yes, all I'm saying is diagnostic tests are very important. We do them at the beginning, and things like HbA1c, blood cholesterol, we will keep tracking them along the way to make sure that we are achieving our objective. Yeah. What was the other question?
Pocket friendly.
Something to do with pocket friendly, yes.
Okay, I don't want to market, but at our center, I work in a place called CardiHub. So we've partnered with Kalebi. In my opinion, his labs are friendly and they are affordable. So that is, but what I can say is that there are many labs. I've seen Pathcare. I don't know if Pathcare is here. So there are many other labs. Just make sure you visit a credible lab. I don't want to market, but just make sure you visit a lab that is credible. I don't know now whether there's a website which has listed all the labs, but just visit a hospital. Avenue is here. Yeah, Avenue has a package. So many hospitals have packages. Now, my opinion about those packages, they are good, but some of them, the tests may not be, it's very important that the tests are customized to you. Because sometimes the package has so many tests and sometimes they may not be really necessary for you at your age, with your comorbidities. So I think the best thing is consult a medical provider and let them advise you based on your medical condition, your age, which routine tests or screening tests would be important for you. Yeah. And visit a credible lab or hospital.
Then just to add, because there was that
1 minute,
section
please.
of,
Just 1 minute.
There was that section of the costs. The cost of healthcare is not cheap. We all know that. And that's why we are really advocating for the insurance with regards to healthcare financing. So for those that do not have SHA and they are in this room, please try and get SHA. Whether there are stories that SHA is not working, SHA is working, make sure you have it, because when you are sick, it will really come in handy. If you have access to other private insurance companies, we get comprehensive insurance for our vehicles. Why can't you get insurance for yourself? So go home asking yourself that question, because it will come down and boil down to when you really need it. Thanks.
All right, there's one more comment.
Thank you so much. I really appreciate the panel and the good work you are doing. My name is Abraham Wanyama from Pathcare. Thanks for mentioning our brand. We are actually here today, and the question I think my sister asked, today we've brought you the services. We are on the extreme end. Kindly, all of you, I request, visit us. It's for free. Body composition, you're going to see for yourselves. Right from, and in fact, I shouldn't talk about it. Please come and check on us. Sawa. Thank you so much.
All right, asante sana. Okay, now before we close this, we want to, since all these panelists are more Gen Zs and millennials, want to do something with them. So we want to do the closing dance. So you're the ones advocating for people, keep fit, make sure you need Dr. Steve's. You're the one who are saying, you need to be working out. Dr. Lillian, you're saying, hey, please make sure you go, take how many steps a day? 10,000 steps. Dr. JJ, you're saying what? Women to be more productive. Okay, screened. All right, sit up on your feet. We just want to do one activity, and then the next panel will be only 10 minutes. I'm very cognizant about time and the weather, so we'll do a 10 minutes, and then I've been informed there's so much food. There's a lot of food today. We were meant to cook for like around 600 people, but of course, you see, we are 60 to the power of 10. All right, so please don't go. We'll be, even if you have something to carry food away, please come with your container, because we're going to be having a lot of food. So please stay around. Let's eat together, fellowship. Just a matter of concern. So once the panel is done, the third panel is done, I'll be able to give you directions in terms of how you're going to be eating. And once more, let me acknowledge our angel of the house, Reverend our Reverend, who has graciously allowed us to be here. And of course, our pastor, our resident pastor, thank you very much. We really, really appreciate. So without further ado, are you ready? Ask your neighbor, are you ready to, practice what you've been taught? Ask your neighbor for me, are you ready to practice what you've been taught? Yeah, are you ready? All right, so I think my panel is ready. Jose, are you ready? Please plug and play. Let's do this. Now you have to get some own space. Eh? You have your own space. Now everybody, check it out. Give me some more volume.
Everybody, let's go.
Check it out.
Everybody go down.
Check.
Go down.
I check it out. Check. And check.
Everybody move to the beat.
And check.
Dance and bring you the spirit. In a can so sweet. Dance, let's get on to business like this.
Pull it.
Pull up. so sweet. For the dancer. You don't know, see.
All right, DJ. Give my opponents a round of applause. Thank you very much. I can see they are all Gen Zs and they are practicing what they have taught. So please, if you want more information about what they are offering from Evolve to Pathcare to Mary Stops, which one else? Yes, that's mine. Yeah, to everybody who came to the panel, please consult with them. We have an amazing team of partners and collaborators. All right. So this is the final panel, and then of course I'll be able to give you direction about the lunch they're going to be having. So I want to invite over to the microphone, Mercy. Please come and introduce your panel to us. Loud applause for Mercy. Thank you very much. Thank you very much. Mercy, over to you.
Thank you very much. So it's going to be a very short panel, and I want to invite, clap once, help me invite, Pastor Githae, karibu. Help me invite Dr. Maimuna, karibu sana. So we're going to take a deep dive, and I allow us, just give me 10 minutes, okay? Yes? Great. So, thank you very much. So I will want you, Dr. Maimuna, to just introduce yourself and tell us what you do.
Hello, hi everyone. Hi. My name is Dr. Maimuna. I am founder and CEO of Taria Health. This is the chronic care session, I'm assuming. Yes. So we are in between health. So you go to hospital and then you're told exercise, eat well, and I'm sure all of you had resolutions. We are in March. Have you met them? So that's what we do. We walk with you in between care. We guide you and we break that down into doable actions. We give you metrics that we track so that you can see progress. So that's what we do. We make health goals stick through what we call health navigation. Thank you.
Thank you. A round of applause. Pastor Paul.
Thank you, Mercy, for the opportunity given. My name is Pastor Paul Githae. The resident pastor in this church under the leadership of our Reverend Virginia. And we want to thank God that we got an opportunity to partner with Equip Health and Wellness alongside many other people who are together with us. Besides being a pastor, I'm an educationist. I've been a teacher for quite some days. Thank you.
A round of applause. Wow, a teacher, that's very important. We are all here because of teachers, yeah? They've really contributed to who we are today. So a quick question, I'll ask you one question that you can be able to elaborate to us, and then I will ask Dr. Maimuna one question, and then you're gonna wrap it up, okay? So how can churches practically support members who are navigating healthcare challenges? Yes.
Thank you. Quite a good question. As you all know, in the church, the congregation is vast, and we have people who have different challenges and different issues. One of the things that the church should do is to one, pray for the person who is undergoing that challenge. The other thing that I still feel is very important is to understand that person, their condition, and what's happening, so that if probably there are improvements that needs to be done, they can also do the same. There comes times when finances are required. I'm not saying that the church is supposed to shoulder everything, but they are supposed to be seen supporting that member, praying with them, visiting them at home, and all that. A little bit of that in our church. We have the Dorcas ministry that specifically checks on people who are disadvantaged or people that require help at certain points, and they have been prompting to that. We've seen our leadership and the pastors, ministers, and our members also paying a visit to those who are in the hospital and all that. However, there are people who keep quiet, they are unwell, they are in the church, something has happened to them, but they keep it to themselves. When that happens, perhaps somebody might blame the church, and the church was not aware of what was happening. So when things are brought to the light, they become lighter. Thank you.
Thank you. A round of applause. So what I'm hearing you say is there is the individual responsibility to come and even share what are some of the challenges that they're experiencing, so that now the church, through the different department, can be able to support. And in your case, is the Mercy Ministry. Did I get that right?
The Dorcas
The
Ministry.
Dorcas.
Yeah,
thank you for that. The Dorcas Ministry. So back to you, Dr. Maimuna. I would want to hear from you, what are the innovative ways to be able to actually access healthcare for the community?
Thank you for asking that. Am I audible? Yes. Okay. I like that you started with asking Pastor about the role. So health starts at home. Charity begins at home. It starts with how we feed our children. It starts with how we educate them about health and what they see from us as the people they will mirror. And when I work with my patients, this is what I see. I'm trying to make them unlearn habits that they picked up from school, from their parents, from their community, and how they were brought up. So that is the first access to health. It's me and you being aware and changing that for the next generation to come. It's the role of institutions like churches, like schools, like communities to say, today we are going to learn what a healthy plate is. What size of our hand should the carbohydrates be on the plate? That is the first role. Charity begins at home. And it is up to us to reverse diabetes from our children at this point, okay? What are we feeding our kids? So the role of community, family, and society is very big. I'll go to the next tier. The next tier, your community health workers, the nurses that are here, the nurses in the schools, the nurses at the workplace, okay? And after that, then we come to primary care, your providers, tertiary care, and now we have telemedicine. You call a doctor. In Rwanda, telemedicine is accessible through your SHA, what I'd call SHA. So you can call a doctor on your phone through SHA. But the most important is your own initiative to educate yourself. You have to take that initiative to know what is a healthy plate, what is movement, and I'm not talking about exercise. So if I leave no one else with any knowledge, there are a few nuggets I want to leave so that we are educating everybody. For example, they say, you may not be able to start exercising or going to the gym every day, but if you do a 10 to 15 minute walk after your heaviest meal, there is a very good chance of reducing your sugar spike. When you eat your carbohydrates, make sure you start with the proteins first, then you'll get much fuller before you eat your carbohydrates, okay? And then finally, learn to manage your sleep and your stress, because even when you have exercised and eaten well, if you don't manage those two, they'll affect your health, yeah? So in a nutshell, take the initiative as an individual to learn the right thing. Then pass it on as charity to the community and to your children. Thank you.
Wow. Thank you so much. So what are your final remarks, even as we close this session? Maybe Pastor Paul, you could start for us. Yes.
Thank you so much. My final remark is that the Bible tells us to be in good health as our souls continue to prosper. And so therefore, when one is unwell, let them seek medical help. And also remember that God heals. It is always good to put our hope and our confidence in God. I would also say when such forums are created, it is always good to pay a visit, to listen, so that you are enlightened. When one has knowledge concerning something, they are able to deal with that issue without major challenges. And so therefore, I'm so grateful, and God bless you.
Okay, can you hear me? Yes, so maybe I will come closer. Have you heard the final remarks? So it's our personal responsibility. Okay, so I would want to invite Pastor Paul. We have the mother of the house to just take it out for us, and then we'll be guided further. Is that in order? So thank you so much for being patient and for learning together with me. I hope we are going to be advocates of the information that we've been able to receive. Over
Thank
to
you. Thank you so much. We are so grateful. Let's appreciate Mercy for a job well done. I always hear my reverend say, when you see young people doing something, it means that it is not likely to die soon. There is somebody taking over and taking over. Thank you so much for all of you who came. We are so grateful. I want to request our ushers to kindly give some flyers that we have. We are planning for a major meeting, a Kasarani Mega Crusade on the 19th to 22nd, which will be right outside our gate, some 100 meters or so, and you will be there. And so therefore we take this opportunity to invite you. I want to thank Mr. Jerry and the wife. Jerry and the wife, you can stand from where you are. Jerry, let's appreciate Jerry and Betty for a job well done organizing every one of us, and I believe that will be good to go. I want to give this chance to our reverend. When we were doing the introduction and welcoming people over here, I said I'm the resident pastor working at the Reverend Virginia. We shall give her this opportunity. But before we do that, allow me to remind you, and I know our MC will tell us, once we have served our food, we do not eat from the sanctuary. There are many rooms where we eat from, so that we keep everything okay. Bear with the weather. We are in the timing of God, and this is the best that we could do. Now help me welcome our Reverend Virginia Nganga, who will speak to us a little and pray for us and even give thanks for the food. Welcome, Reverend.
Thank you, Pastor. Bwana Yesu asifiwe. Bwana Yesu asifiwe. I'm very grateful to be here. I have run a lot. Na nimefurahia sana kuwa pamoja nanyi. Tumefurahia sana kuwa pamoja nanyi kuwa hapa. Bwana awabariki sana. Na tumeweza kubarikiwa pamoja nanyi, na tunataka kuwakaribisha tena. Bwana Yesu asifiwe sana. Tunataka kuwakaribisha tena na tena na tena. Wakati ambapo mtasikia kuweza kuja upande huu, tunawakaribisha. Nataka kuwapea chakula tuweze kuondoka. Baba wetu, katika jina la Yesu, tunakushukuru kwa sababu ya nafasi hii ambayo tumekuwa pamoja mahali hapa. Asante kwa yale ambayo tumeweza kujifundisha. Asante kwa sababu ya yale ambayo tumejua na tumeweza kufahamishwa. Tunasema ni asante kwa wema na uaminifu wako. Asante Bwana kwa sababu ya vile ambavyo tumeelimishwa Bwana, na tumeweza kupata elimu bure. Na hata wakati huu Bwana, tunapoenda kufurahia chakula chetu, tunaomba Bwana ukaweze kutubariki pamoja na tukaweze kufurahia chakula. Tunaibariki kwa jina la Yesu Kristo. Chakula ikaweze kubarikiwa, na tunapoishiriki ikaweze kuwa baraka kwetu. Katika jina la Yesu Kristo tunaomba na kushukuru. Amen. Mbarikiwe sana.
All right, thank you. Let's appreciate our angel in the house, our resident, our pastor, Pastor Virginia. Thank you very much, our resident pastor. Tumeshukuru sana. Now, these are the directions to how you're gonna be going, how you're gonna be eating. Where? The weather. All right. So there's a designated place for pastors and doctors. I think towards my left, or no, to the back. There's a place where it's been designated for the doctors and the pastors, the men and women of God in the house. At my extreme back on my right side, towards the direction, And then the rest of us, as you have been instructed, kindly, if you take your food from the back, please locate one of the rooms, cover your food nicely with your body or your umbrella, and find yourself in one of those rooms so that we avoid eating from the house of God. All right? Have you understood? Are we together? Yes. So let's adhere to that. And then ushers, if you have umbrellas, ushers or anybody who has an umbrella, kindly come and issue an usher with it so that we can escort our doctors and pastors to the rooms where they're supposed to take their meals respectively. So I kindly appeal, ushers, please locate anybody who has an umbrella who can volunteer for just a few minutes so that we can offer or give our men and women of God and also our doctors to be able to access where they're going to be sitting and resting. Thank you very much. So I'll start with Dr. Maimuna, please. You can, there's an usher with an umbrella. Please go and be escorted where you're going to be eating. Dr. Steve, Dr. JJ, please follow suit. Anybody else with an umbrella?